I am Dr. Suri, kidney specialist and transplant physician. Today I will be discussing on heart failure and management of edema. As you all know, heart failure is one of the most important causes of mortality in India. Heart failure is very common, and the important causes of heart failure include acute coronary syndromes, then valvular heart disease, metabolic diseases like diabetes, hypertension, uncontrolled diabetes can also cause heart failures. They are known as diabetic cardiomyopathy. Also, other causes include chronic kidney disease, especially patients on dialysis who have got hypertension, anemia, and all those things can cause heart failure. Basically, what do you mean by heart failure? Heart is a pumping organ and it has got 4 chambers. Basically, the right side of the heart, there is a right side of heart which pumps the blood through the pulmonary circulation into the lungs, and there is left side of heart which pumps the blood to different organs of the body through the aorta. If the left side of the heart, that is the left ventricle, if it fails, it produces LV dysfunction or classical left ventricular failure. And the important symptoms of left ventricular failure are dyspnea, that is breathlessness, and also paroxysmal nocturnal dyspnea, in which the patient feels breathless during that. This happens because the left side of the heart cannot pump the blood forward, so it pumps the blood back into the lungs, and this causes edema in the lungs. Then there is also known as right-sided heart failure, in which the right ventricle is weak and it cannot pump the blood into the lungs. So what it does is that the blood circulates back into the atrial right atrium into the great veins, and ultimately edema happens because of the black flow of the blood into the venous circulation, and this produces congestive hepatomegaly and also edema. And basically there's known as congestive cardiac failure, in which there is biventricular failure, in which the patients have symptoms of left ventricular failure, which includes dyspnea and PND, and also symptoms of right ventricular failure, which includes edema and congestive hepatomegaly. Now, the treatment of heart failure involves, first of all, dietary restriction, in which the salt has to be reduced. Normally, the daily salt consumption of human beings is around 5 to 6 grams. However, in heart failure, especially if it is coexistent with kidney disease, then the salt restriction has to be made, and the salt restriction is around 2 to 3 grams. Second, includes certain medicines which remodels the heart, which includes ACE inhibitors, ARBs. Third, medicines include nitrates, which decreases the preload to the heart so that the functioning of the heart is also reduced. Then beta blockers are also important stay in the treatment of heart failure. But the most important drug is diuretic, which reduces the symptoms of both the edema and also pulmonary edema or fluid in the lungs. So diuretic has to be used depending upon the situation. The dose of the diuretic has to be modified. Then there are other symptoms of heart failure. There are other treatment of heart failure which includes like CRT, which is a resynchronized therapy, in which a lead is placed in the left ventricular and it synchronizes the left ventricular so as to pump adequate amount of flow. And also SS devices have come into vogue, which also helps in chronic heart failure. Last and foremost is heart transplant. If the patient doesn't respond to any other treatment, and if it is a chronic heart failure in which the survival is less, then the patient can undergo cadaveric heart and lung transplantation if required. Thank you.